Welcome to the Prevail Over Cancer Podcast, where we take a metabolic approach to help guide you on preventing, prevailing, and striving over cancer.
We are live on the Prevail Over Cancer Podcast. I'm one of your co-hosts, Jeff Lopes. I got my incredible other co-host, Keith Bishop there. How are you, Keith?
There. Doing great. And you?
I'm doing amazing, buddy. Super excited to have a fellow Canadian here. I just found this out right now. Dr. Amy Morris. How are you?
Good. Thanks for having me.
Incredible story. We were just talking prior. Your journey through cancer and what you're doing to help others right now is pretty amazing. Your social media presence is amazing as well. So excited to hear your journey. And I just want to get right into it. Like, when did you find out you had cancer? How did the whole process start? Let's just get right into it.
It actually started long before I was diagnosed with cancer.
Okay.
So I started my career actually as a pharmacist.
Oh,
so Keith and I are that way. So I did my undergraduate degree in pharmacy at the time, and I think it's the same for Keith too. When you did your undergraduate degree in pharmacy years ago, you didn't get that doctor designation that the kids get now, right?
Mm-hmm.
So that was the case for me as well. I was just an undergraduate degree. After that, I decided that I wanted to do more work in acute medicine. So I did what's called a residency that's pretty sought after. And after I was done with that level of training, I thought, I really want to work in cancer care. And I had no reason why until I realized now there was a very clear higher power or fate or whatever you want to call it pushing me in that direction. But I had this drive to work in oncology. I had no family experience, nothing. So I kind of pestered the local cancer clinic to give me a job until they finally said yes. And then I started working there and I just thought, gosh, every time someone comes to me with a problem, with an issue, with a challenge, right? The solution is always another medication.
Yeah.
So for example, like tamoxifen or joint pain from tamoxifen or aromatase inhibitors in breast cancer survivors, or joint pain from Keytruda or other chemo treatments, the solution was always take Tylenol. I mean, take Tylenol for 5 years, for 10 years, for the rest of your life. Like this, I was like, something's missing here. This cannot possibly be the solution to always have a drug for another drug. So at that point, I decided to do my doctorate degree, University of Toronto. I focused in helping people get rid of side effects and stay cancer-free. So stay on drugs that could potentially save their life without having side effects, without using other drugs to treat them, or use lifestyle, diet, exercise, supplements to help them stay cancer-free and free of side effects. Because really, if you've survived cancer, that's one thing. That's amazing. But if you're a shadow of the person that you used to be, then what the heck's the point of all of this? And so after I finished my doctorate degree, I came back to where I grew up, where my husband is. We were planning on getting married that summer. You know, we had September wedding, beautiful wedding. We'd been together for years prior to this. He's my best friend. 6 weeks after our wedding, I was personally diagnosed with ovarian cancer. So that's truly where my cancer story begins.
What year was this when you were in Toronto University and you kind of open up your horizons to understanding more about, because what year was that in roughly, give or take?
In 2012.
So it's just pretty amazing because I'd find that, like I said, I was diagnosed, I just passed my 2-year cancer free. And and then you find that the last 3 years, 2 years, you're seeing a lot more with the whole social media burst of individuals like yourself and Keith and myself and others spreading the word of the metabolic, the holistic way, the fighting. For you to be already focused on 2012, is pretty amazing.
Yeah, I mean, at the time, I'm OG social media cancer survivor. There's a small group of us.
There's a very small group.
But hey, look, like when I looked around, I was like, there is nobody around me that looks like me.
Yeah.
Like all of these people, they're lovely at the cancer center next to me, but they're 20, 30 years older than me.
Yeah.
They have a whole different set of problems. They're not worried about, are they going to be able to pay off their mortgage? Right? They're not worried about those things. They're worried about completely different things that are valid. So that's when I turned to social media. And actually, I started by live streaming my chemo sessions on Facebook Live.
Wow.
That's how I really broke into social media.
And what year was this?
This is 2016.
Yeah.
So at the time, Facebook Live, this is quite novel, right? So my best friend and I just decided, like, look, if there's anyone that can show people what it's like to go through cancer, it's me. Like, I've got the clinical understanding, the research understanding, and now I'm going to go through it myself. So let me live stream my chemo and answer people's questions during those chemo sessions. You can still find those videos on my YouTube. If you go back my oldest YouTube, those videos are posted there.
I love that. Let's just go back to diagnosis. Like, what were your symptoms? Like, 6 weeks, like I got married September, great month to get married in, September 20. So you're going through the whole process. You're the happiest time of your life. You're everything just seems like you're on top of the world. You got a great career happening. You're doing something you have a passion for. You're with the love of your life, and all of a sudden, bam! Like, what were the symptoms leading up? Just for other individuals that are watching us could kind of connect those symptoms to it. What are the symptoms? What triggered you to, I guess, research your body and figure out what was happening? So how was the process there?
I wish this was easier to share with people. Like, I wish it was more clear cut.
Okay.
Because I get asked this question a lot because people want to know what they should look for in themselves, right?
Yeah.
I will tell you, for me, the honest truth is that my number one symptom, the symptom that pushed me to finally go to the doctor, was heartburn. I had heartburn all the time. I have had Tums in the drawer of my desk at work at the hospital because I just didn't matter what I ate. I would just heartburn. And I thought, gosh, this is going to be an easy fix, right? I've obviously done something. I've got some sort of something going on. Let me go to my GP. And this is going to be like a pill, a test, and we'll wrap this up and get rid of this heartburn. And to her credit, and she's still my GP, and to her credit, she was like, well, let's just run some tests here. Okay. Let's see if you have like H. pylori. Let's see if you're pregnant. Right? You just got married. Let's see if you're pregnant. Maybe that's it. And then when all those came back negative, she was like, let's just do an ultrasound of your abdomen. Because, like women have cysts on their ovaries, all kinds of like just really benign things. So let's just see if anything's going on. And that's when we discovered there was a mass on my ovary.
So isn't that the case of ovarian cancer? It's not an easy diagnosis, and it's often late stage before it's discovered, because there's no one single symptom.
No. I mean, a lot of people talk about bloating or changes in their bowels, painful sex. That wasn't the case for me. I mean, I maybe had some bloating, but I mean, at the time, I remember standing in the hospital and saying to one of my coworkers, like, do I look bloated to you? I feel so bloated. And she was like, oh gosh, Amy, like, you look great. Like, that happens to all of us, right? I'm like, okay. And so it really wasn't like, oh my gosh, I feel like I'm 9 months pregnant. That wasn't the case for me.
Mm-hmm.
It's pretty crazy. Yeah. Sorry, Coach. So go right, Keith.
Yeah. So, matter of fact, you're the first person I've heard with a heartburn symptom, which is kind of surprising. I wasn't aware of that. and I'm rather even shocked, with that. And so this, matter of fact, a friend of ours, a young lady, was also having some digestive issues, and luckily, that doctor they did an ultrasound and thought, well, maybe there is something, but then they did a blood test, and actually it was elevated, and that actually created a little bit of a scare.
Yeah, sure.
So would you share what that test is, the blood test and that kind of thing?
So I think you're talking about CA-125.
Yes,
Would
right.
be a common test to help, and I say help,
Right.
with the diagnosis of ovarian cancer. Now, the reason why you got to be cautious, and like you say, there was a scare, is because CA-125 can be elevated for so many reasons, and it absolutely does not mean you have cancer.
Right.
But this is like a piece of the puzzle, right? And so we often use CA-125 to monitor for ovarian cancer recurrence.
Yeah.
So it's a useful tool in that scenario. Once you've already had it, you're cancer-free, we use it to monitor. But to use it up front, I mean, it's got to be used with other tests, right?
Right, exactly. That's what happened. Our friend, she went in, they did that test, and I mean, as needless to say, panic.
Yeah.
And because it was elevated, and so mom and her were just, really just upset, and then they had to go in and do some more scans, and found out that wasn't the issue, and it was actually still a digestive issue, was the underlying issue. So
it's amazing you're saying that. Because, sorry, let me get in there, Keith. It's when for colorectal cancer you do your reoccurring test, it was your CEA test. And it's interesting you're saying that, because my numbers when I had an active cancer were lower than they are now. And now they've been steady, but they were so low that if you were to relate it on a test like that, I would not even be aware. And I love that you're saying that, because heartburn, ovarian cancer, know to connect those two. And when I look at myself, when I got diagnosed, it was a situation where I didn't smoke, I didn't drink, I was healthy, I was working out, I thought I was fit. And I just had the luck of race here that my tumor was just in the right spot in my rectum, that every 3, 4, 5 stool movements, it would just scrape it and get a little blood on it. If it was about 2 inches higher, 1 inch higher, I would never have seen that blood. I would never even thought of anything, because I was sleeping right. I was healthy. I was feeling good, had no symptoms. So it's scary when you look at a situation like yourself, where something like heartburn, and most people will go a year, 2 years and just keep slapping those Tums and not even thinking anything of it. So you have to trust your intuition if you do, and be on top of it, because you just never know the connections. Now, what you're looking at is, I just want to go through it. As somebody that doesn't have a medical background, what are the connections from heartburn to that? Like, what were the connections there? What was causing that heartburn?
So look, I mean, my social media haters, right, will definitely say, oh, now everyone's with heartburn's going to think they have cancer. You know what? Look, there is a difference here, right?
Yeah.
There are billions of people that have heartburn.
Yeah.
The difference here was it was new. It was brand new. I never had heartburn, and it was sudden onset. Like it was within a couple of weeks. I was like, what is going on? Now, the reason why this has really presented in me the way it did was a pressure in my abdomen. Right. Instead of getting the bloating out, I was getting pressure going up. So the tumor was putting pressure on all of my digestive organs, which was causing the acid reflux then.
Did you go directly? Sorry, go, Keith.
Oh, no, go ahead, Jeff.
I was going to say, did you go directly? What was the procedure right after? Did you go directly into a surgery? Did you go into treatment? Like, what was your next step?
So I had this ultrasound. My GP calls me, and says, look, you got a mass on your ovary. So the next step is to see a gynecologist. She's like, look, you're really young. All sorts of things can happen on women's ovaries. Chances are this is not cancer. Okay. So i.e., don't freak out. Totally freaked out. Totally. Big time meltdown. Okay. Really, because at that point, your entire world's falling out from underneath you. So I get an appointment with a gynecologist in the city I live. And the gynecologist with the earliest opening has a reputation here. He's retired now, but he has a reputation of being the crustiest, grumpiest bedside manner. Of course, he's got the first opening, right? And I was like, well, I don't care. Let's go, right? This guy, I've never had someone advocate for me the way he did.
Awesome.
Because he was like, look, let's not get carried away, but we need to do a CT scan. So he's like, here's what I'm going to do. Meet me at the hospital tomorrow morning. Go to the emergency room, 7 a.m. I'm going to be there. I will get you in for a CT scan. You don't have an appointment, but I'm going to make sure you get in one. I was like, okay,
Wow.
let's do it. So this guy, crusty as heck, got me in for a CT scan. We sat there for about half the day. I mean, that's not so bad. We sat there for half the day. He comes back in, sits down beside me, and he says, I'm sorry, you have cancer. And that's really where things started for me. So the next step was to meet with my oncologist, my gynae oncologist, who this crusty guy had trained. So a much better bedside manner, though.
Yeah.
And we got me in for a surgery date, huge surgery. They opened me right up, 35 stitches down the middle of my abdomen to remove the tumor and one of my ovaries. And then after I recovered from that, then we started with chemo.
So did they find any other spots or anything like that? I mean, that open, I mean, I've seen those surgeries, and I mean, they're in all the way, feeling and looking and stuff like that. Did they find any other issues or?
I mean, because I have a stomach of steel, okay? So I can take all the blood and gore and guts. I said to my surgeon, my oncologist was like, hey, look, take some photos during that surgery. I'm like a weirdo like that, right? I'm like, take some photos. I was in recovery. He airdropped them to my phone. He's like, are you sure? All right. Okay. He's airdropping these photos, like essentially selfies with me, like open on the table, right? And the problem was I ended up being stage 3 because of the size of the tumor and because it had spread into the abdominal cavity.
Okay.
So that's what you're alluding to there. So I had my omentum removed. He removed as much as he could, and the remainder we hoped would be taken care of with chemo.
Mm-hmm.
So it had already started working its way into, I guess, the muscle into the wall, I'm assuming, right, at that point?
Yeah, like because of the size of the tumor, it was already touching, things around it. So it wasn't necessarily like spreading to my brain or my lungs right? It was like, because it was so large, and that's what pushed it.
Had it worked its way to your lymphatic, like your lymph nodes and stuff like that around the area already?
So I had lymph nodes removed from my groin, and those were positive.
Okay. And did they ever think of going back in to remove any more lymph nodes after that?
So what happened was during the surgery is when my pathology, like most, was when my pathology was done. So my surgeon knew before the surgery, like we had already had this discussion because I was newly married. We had no children. I was 30 at the time of my diagnosis. I'm so far from menopause.
Yeah.
I mean, I was truly blessed because he was the one that was like, look, let's just take one ovary, leave the other one, give you the chance of fertility. And then we'll go in back after that. He's like, I'm confident that we can use the chemo to get the cancer from the other ovary. And I was like, just save my life, And he's like, chill out, So that's what we did. And like, to my credit, because I'm not someone that was like, my dream is to be a mother. That was just not on my radar. It was like my life first, selfishly. Yeah. I now have 2 children after all of this. But that was just my approach in that moment of trauma, right? And so he advocated for me to be like, look, we are going to do the surgery, take the one, get as much as we can, then do the chemo, then we'll reassess. And at the end of the chemo, all the cancer was gone.
Amazing.
Well,
And you did
great,
you did 1 round?
No, I did 4 rounds of chemo.
4 rounds.
Yeah.
Okay.
Mm-hmm. So did they want to, or they suggest or do anything about like egg harvesting or anything like that?
We were confident at the time to move forward with the treatment as fast as we could. And the direction I got about fertility was that they would be confident we could do something after, like I would preserve fertility after. So that wasn't going to be necessary.
Okay.
Now, look, everyone's story is very different about this, especially when it comes to fertility. And this is a very emotionally driven subject, right? So all I can say is that's as transparent as I can be. I know there are women that just have this really strong desire to be mothers and to carry their own children. That wasn't me at that time. And the reason that I made some of these choices was because of that, I mean, whatever, 8 years ago.
How old are your little ones now?
So I have a son that just turned 6 and a daughter that just turned 3.
Amazing. Boy and girl, just like me. I'm flipped the other way, but mine's are a little older. Mine's turning 19 and 17 too. So time flies.
Yeah.
With that, I don't know if you want to jump in on anything, but with that, from the diagnosis to the surgery, what was the period of time?
So I was diagnosed so I'm Canadian, so I was diagnosed on Remembrance Day, which is around,
November,
I was diagnosed
November 11th.
9th. So
Okay.
November 11th is Remembrance Day, but I was diagnosed right before, and my surgery was November 25th.
Oh, so it was that close. Okay.
Yeah.
I was going to say, I was wondering because mine was November 23rd. I had my surgery February 16th, and I prolonged my surgery because I wanted to prep my body for the surgery. Same as you. It was
sure.
surgery.
Yeah.
So they never did a biopsy or anything like that. They just assessed it through this CT scan and went in. Okay. Where's you as a doc? And I want to talk to Keith about this. We kind of hinted on this, and this is a question I was actually I was reading up on it a bit more the last couple of weeks, and it's something that I've questioned because my tumor was obviously enclosed. They went in when I did my colonoscopy. I woke up to them saying, "Hey, we did without even my permission, they did a biopsy. They went in and took it out right away and they sent it out." So I woke up to being like, "Hey, you got cancer. We already sent it out." I'm like, "Oh, okay." And I ended up having one of my lymph nodes after they cleaned me out. They ended up removing all the lymph nodes in the whole area. It took out 23 lymph nodes. They cleaned me right out to 65% of my rectum out. They wiped me out. And one of my lymph nodes had a little trigger, a little sign that something was happening, was trying to go rogue. I've talked to Keith about this, think that because of the biopsy, it kind of opened up the door and allowed everything to spread. Where's your mindset with that, with doing a biopsy and having that opportunity of it spreading? And I've been reading a lot more with that. And I'll ask you first, Dr. Morris, and then I'll ask Keith.
This is highly specific to the type of cancer you have.
Okay.
Right? So to say biopsies are garbage, they're going to cause your cancer to spread, that really... And this is not only my problem with biopsies, but just talking about cancer in general, is that cancer is like 1,000 different diseases under one umbrella.
Okay.
So to say oh, well, Amy, you had ovarian cancer and you didn't have both your ovaries removed. That's my specific situation, right? Someone else could even have ovarian cancer and need completely different treatment path. So for ovarian cancer, it is a standard not to do a biopsy.
Okay.
You do want to go in and try to encapsulate and remove all of the tumor intact.
Yeah.
So that's the case with ovarian cancer. Now with breast cancer, it's a different story because we haven't seen that biopsies actually cause progression or spread of cancer, right?
Okay.
And so we still have to take this specific to you, right? And that's why I love talking about cancer online. I know both of you do as well. But you always have to keep in mind that whatever you're consuming online, it might not be specific to your situation.
Okay. Fair enough. You want to jump in there, Keith?
Or yeah. And I've researched this extensively, going through the medical journals, and there is no evidence that biopsies increase the risk of reoccurrence or spread or metastasis. Mm-hmm. So, which then people say, well, they're hiding the results, so they're trying to skew the numbers and things like that. So, it's something that we need more information, and but sometimes biopsy is the only way to get that information, to know for sure that that's what that is. And so, a friend of ours with a lump, a breast lump, and so she went in for a biopsy and it wasn't cancer.
Yeah, right.
Without that, she wouldn't have known. She would have had to go into for a lumpectomy,
Lumpectomy, yeah.
or and start so it's a tough call. It really is. So far, the research doesn't really show that kind of a risk for that. So, but it is an invasive procedure. We want to try to minimize that. I do believe in trying to support the body and build up the body to, the immune system.
Yeah.
Have it ready because, of just chances of infection, and zinc and iodine and various different things for the immune system, and to help normalize cell growth and differentiation and things like that. So I do try to, I want the body to be ready for that, Jeff, kind of like what you did for yours, delayed a little bit on surgery, try to build yourself up and get ready for it. So same thing for biopsies. I'll recommend, kind of a little protocol to go through to get prepared for that.
Yeah.
Look, it's a valid point, right? But what you're alluding to is that you should use every strategy available to you. I mean, to say like, I'm just going to let the healthcare system do their thing. And my doc, I can eat whatever I want. Like, are you kidding me right now? Like, I'm a cancer survivor myself, right?
Yeah.
And someone that's like classically trained, like that like big institutions across Canada, that's where I was trained, right? As someone for myself, I would be totally dumbfounded to say, I'm going to pick either Western medicine or traditional medicine, one or the other. That's so silly, right? Like just because you feel like you have to fall into a camp, why don't you pick everything that works for you? So if the biopsy works for you, great. If chemo, surgery, radiation, great. But you cannot neglect everything else. You cannot neglect supplements and your nutrition, your movement, your mindset, non-toxic living. I mean, it's not one without the other,
Yeah,
that's right. Yeah. And I appreciate both of you sharing. I mean, you had to have surgery to kind of debulk and get rid of that mass, that large number of cells. I have people, that will ask me, should I do that?
Mm-hmm.
And which is a tough call, but I would probably I'd be the same type of way. It's like, cut that out, get that out.
That was the first thing that came to my head. The minute I was diagnosed, I literally felt sad for about 2 hours, sat down with my kids, my wife, the story, Keith, at the dinner table, told them the situation. My daughter looked at me and said, you better walk my ass down the aisle. And I felt my feeling sorry for myself ended right there and was like, okay, you're getting in the zone, let's go. And that's what happened. I just literally went, and exactly what you're saying. It was the whole, let's do saunas, let's do supplements, let's do stuff. Let me engage with people. Let me read as much as I can. Let me learn as much as I can about cells, about your body, and I just went overload on everything and went 120%. But that mindset, exactly what you're saying, is you have to understand that a lot of people are still in that boat where they're going to listen to what the doc says. And my doc said, I sat in front of him. Keith knows the story. I sat in front of my oncologist and I already had everything planned out. I had everything mapped out. I knew exactly what type of chemos he was going to recommend. I had everything. I had a whole book I wrote, and I literally sat there in front of him and I said, okay, and he said, okay, this is what I'm going to recommend, A, B, and C, this treatment. And I pulled it up and said, is it this? These are side effects. What's your mindset? What's the long-term? And I started asking questions, and he was kind of startled that I was asking these questions. And I said, okay, let's sit down. And he's been incredible, but I said, let's sit down and let's talk about nutrition. Let's talk about diet. Let's talk about exercise. And he says, there's no science behind that. That's his words to me. He goes, I only focus on science. And the minute he said that changed my outcome of where, and I didn't do the chemo route. I went more the metabolic natural route. But it's some people, we talked about this, the chemo route is what's needed, but you still need to tackle it from others, because the supplements, the diets, all that will make that chemo route so much more tolerable for your body. And with the fasting, your body can react better with the chemo. There's so many factors of other things we could add into it. So it's a whole holistic and it all individual. I love you're saying it. It is individually set, right?
Like, think about it this way, though, right? Like, a lot of times I do hear, and I mean, I had an exceptional oncologist. I will say that. He's retired now because he went on stress leave. Like he just cared so much.
Yeah.
And then he was probably around the age of retirement anyways, so he's retired now. But if I said like, look, what about nutrition? And my husband's a PhD in nutrition. So like, we're going to do this, right? And he's like, I don't really know much about that. Because look, a surgeon is going to cut, a pharmacist is going to give you medications, an oncologist is going to recommend chemo. Like, stop asking clinicians to be something they're not. Like oncologists don't know anything about nutrition. And thank God they're geniuses in chemo and scans and blood draws and like that scope. But like, don't ask them to be something they're not, because they're going to either give you an answer that's really dumb, right? Like you got, or they're going to give you an answer that's really honest, like what I got.
Yeah, but I think that the issue is the uneducated mindset of most people is they do not think that. They think an oncologist or an MD or they have full knowledge of the whole spectrum of everything, right? So I think people have to understand exactly what you said. They specialize in one thing, and if you want that, you're going to have to go to another route to find the other questions and answers, kind of thing. So I love that you said that.
It takes a special change in a mindset for a doctor, oncologist, to make that shift, but they're also limited because they're associated with the hospital, and they're limited on what they can say and what they can recommend. So 20 years ago or so, a local oncologist at the largest hospital in our area asked me to speak to their doctors at a breakfast meeting. And there was probably 20 oncologists there. And the topic was, what are people doing? What's the public doing? And that's what I shared. This
What
is
do you mean? Like, what's the public doing in terms of cancer?
Yes, exactly. What are they taking? What are they taking?
Why don't they ask them?
But the problem is that, see, they don't want to know.
Yeah.
And they don't want to know. Now, this particular person, he ended up becoming the medical director of this hospital. He's still there. But actually, there was like 3 doctors. They were so upset and mad at me, and that's all. And this doctor stood up and said, "No, now, just a second, do not attack him," and it became a shouting match. They were yelling at me. And he said, "I invited him here to tell you what the public is doing, where they're getting things and what they're taking. I invited him, for this, so that we can learn, from that." And then one guy just got up and he just left. He just walked away, and so, but anyway, they just don't know. And they really, of course, that was 20 years ago. Now they're with the public access to information, podcasts, social media, they're learning a lot more. So now they're really, being, educated more from their patients now more than ever. They still say, no, that there's no science behind it, type of a thing. And so, although I did hear actually this same doctor, I'm surprised he's still practicing. I don't know how old he is, but he's still there, and evidently he's still the medical director at this hospital. He actually told a patient the other day about a repurposed drug. They asked, well, what else can we do? And he actually said, well, you may want to try this repurposed drug. Mm. And I was kind of shocked about that. And so, but he's not saying you should do it, but he, and matter of fact, that's the referrals I get from him. It's more like, they'll say, well, doc, what about taking such and such? And he'll say, I really don't know. He's willing to admit, I don't know, but Keith has had some success. You go contact him. Yeah. If you're interested in that area. So he's trying to protect himself, but still leave that door open and let them know that, there may be something to it. So he's seen enough results from what I've done to where he's kind of more open.
Yeah. Yeah. When the clients, the patients that I work with primarily women. And the women that I work with, and what I've always tried to attract, are the women that are high achievers. These are the women I work with are impressive women. Like they own their own businesses, they're VPs, they're doctors themselves, they're lawyers, they are stay-at-home moms that take care of everyone in their community. Like they are impressive women and they are well-informed. So when I speak with my patients, and I just had a conversation about tamoxifen with someone yesterday, and I'm asking them questions to try to help them make their own decision. Because I start off that conversation by saying, look, you are smart. You are well-researched. You are capable of making whatever is the best decision for you. And I want you to know you have my support either way. You take tamoxifen, let me help you eliminate all the side effects. You choose not to take tamoxifen, let's use your lifestyle strategies to drop your risk of cancer. Whatever you choose, I've got your back. Let me help you make this choice because you're capable of it. Right? This isn't like, you're not going to take tamoxifen. No, they are intelligent. So in terms of like people coming and being upfront with me about what they take, I'm always like, yeah, tell me. Maybe there's something I can learn. Let me dig into it. And I'll tell you, like, look, there's no science behind that, but is it going to hurt you? Probably not. Or yeah, there's going to be a ton of side effects. I actually think this thing's going to be better for you. Like it just allows to have like a much more comprehensive conversation when you actually put some trust into the patients you're speaking with.
I got to jump in there. I love you're saying that. So Keith knows this about myself. I've been an entrepreneur for almost 30 years and I've done a lot of stuff. And I took cancer as I almost created a business plan for it. And I'm like, okay, this is my business plan. This is how I'm going to tackle. This is how I'm going to get ready to surgery. This is how I'm going to get out of the hospital. Everything was planned out. Everything was planned out, written. I had journals, everything I ate. When I got home, how many laps around, I walked around my kit, like everything was planned. And they're like, after surgery, they're like, don't even joke of lifting a weight for 6 to 8 weeks. And 2 weeks later, I was in the hot gym, pretty much fully working out again. But I love that you said that because working with more high achievers, you know, they're going to go full out. They're going to give everything they can and they're not going to shy away from, if it's going to my mindset, it was, if this is going to give me a 0.1% chance of survivability, I'm going to do it. And I think that is my entrepreneurial mindset of just go out and go full. So I love that you said that you're working with high achievers because do you not feel that that makes your life a lot easier because you know that they are going to give full commitment to something?
Oh man, easier or harder? I don't know.
Harder.
Right?
You find it, you think it harder, huh? Interesting.
They challenge me, right?
Yeah. But I think you like that.
Exactly. Like I'm grateful because I truly do love, like there would be no better way to spend a Friday than sitting around reading a bunch of scientific research.
Yeah, I love that.
Yeah, Keith, I knew you'd have my back because it sounds like super lame. But when they're like, Amy, can you dig into this for me? I'm like, woohoo, okay. See you in a week. I'll tell you what I find out, right? So for me, it is more challenging, and I can see that challenge in me because I'm a former athlete. I'm a competitive person that I'm like, oh yeah, let's go, right? But I can see that wouldn't be for every clinician.
Do you want to jump in there, Keith? I have one more thing I need to dive into with you, but you want to jump in there, Keith?
Yeah, well, just it is a time factor, a part of that and that challenge, and so support is very important. And so, some people, are driven and it's an easy call for them, or easy, for them to just jump in and do it and read and learn and be in charge of that. And then we have the other clients that it's actually the spouse that is going to be the one that's in charge.
Yeah.
And so, but somebody has to be in charge of that. And it's part of my screenings that I do too, so I know to try how to support a person is to try to give evaluation of their social and relationships and things like that. What kind of support do they have?
Yeah, and I think it's very important.
That makes a big difference on what to recommend and where to start from, and even finding out what to get an idea about what kind of changes are they willing to make. How aggressive or how bad are their food and lifestyle issues And are they willing to make a change? And some people aren't. Some people are not willing.
Not everyone's like Jeff, right? I call that your risk appetite, right? So not everyone's like Jeff, where it's like, if it's a 0.001% chance of lowering my risk, I'll do it. Some people are like 10%, drop my risk by 10%. That's not very much. And again, I'm like, hey, look, it's your risk appetite. That's not right or wrong. It's up to you.
Yeah.
So let's find that out and see where you fall. And you can change your mind in the future. Yeah.
I want to dive into something that I seen one of your posts, and it's something that I go through, and I think is so important to hear it from you, from me, as cancer survivors, because it's something that everybody has. And I saw one of your posts, I love it, is the anxiety of every time you got to do a test. Every time you got to every time I do every 3 months, I do my CA test, or now I'm up to, we do once a year, my PET CTs and stuff. And when I do it, I don't know what it is in Calgary, but in Ontario here, we have something called My Chart. So I actually learned how to read all my results. So I usually have an appointment with my oncologist a week after. Usually within 24 hours, I've already read all my results. And it's one of those things where it's like, I have it on my computer, I log in, and I have to push a button. And I'm like, don't push it. And the guys in my office, I got my staff here, and all my staff, they know that. I'm like, and they're like, come on, just do it. I'm like, don't push a button, don't push it. It's the anxiety you build, and that nerves and everything. And then it's always like, if I get the results on a Friday, I'll usually not read it till Monday, not to ruin my weekend. That's like, I'm going to go with my children this weekend. We have something to do. So let's talk about that, because it's something that's so natural and everybody goes through it. So it's not something that, if you are having those moments of anxiety every time you have to do another test, or it's natural. So talk about that.
So this strategy, I'll leave you with a really practical strategy that you can do. So you're right. This is completely natural. We know 96% of cancer survivors have fear of recurrence. Okay. So this is everyone in a sense. Unless you're a sociopath and you're in the, and I apologize if that's you listening, but I mean, everyone has this. Okay. So what I would suggest to you is to think, use the flip it technique. Okay. So my mindset coach in the Cancer Freedom Program, this is her technique. I'll give her credit. Okay. So the flip it technique is, if one possibility is true, logically, the other possibility could be true as well. So you're sitting there with this button saying, what if my cancer's back? What if the number's up? What if I'm sick? What if it's in my brain? What if this is metastatic? Okay. But the opposite, as a logical person, as an entrepreneur who's built businesses, a father, as a logical, rational person, the opposite is true as well. Could be. Okay. So I want you to think, what if my cancer comes back? Feel this in your body. How does that make you feel? And then I want you to say or think, what if my cancer never comes back? How does that make your body feel? How does that feel internally? Because this is a confidence that you need to practice over time, right? You had some trauma happen to you, which was a really bad news outcome. So now what's happening is you're expecting bad news every step of the way. That's valid, right? Because of this thing that happened to you in the past. So we just need to retrain your brain to expect a good outcome. So what if my cancer comes back? What if it never comes back? So now you start walking into scans and blood tests like a little bit cocky almost. Yeah, scan me. You're not going to find anything. Take a blood draw. Nothing going to be there, right? So as you practice that over time, that's eventually where you'll be.
I love it. And it's funny. I'll let you go and finish off, Keith, but it's funny because I have slowly got into that mindset, because I've always been the type where I've even coached other entrepreneurs, and it's like, even just self-talk, where it's like, oh, I got to go pick up my kids from school. No, you get to pick up your kids from school. How do you word it? How do you actually say stuff to yourself? How do you self-talk? I just did a talk for a baseball team, a high-performance baseball team, and it was all about self-talk and self-awareness when you're going up to the plate to hit or pitch and all this. So I love that you're saying that, because it is, over time, you have to have that, almost that arrogance, that cockiness, where it's like, I got this. And that's my mindset with the whole 0.1% is like, I've done everything I possibly can. So knock on wood, this to come back, I don't feel like, oh, I should have did this. I don't want to have regret. I try to live with zero regret with everything I do. So that's why I do everything to the max. But I love that because it is something where it's like, as it's been 2 years now, like I have become like, this shit ain't coming back. Like I've become that way. But sorry.
This is a good point when people say, I don't want to call myself a cancer survivor.
Yeah.
Because there could be many reasons why you don't want to say that word, but I don't want to call myself a cancer survivor because I'm not cancer free, because I'm not sure if I have cancer in my body.
Yeah.
I have a one-on-one client I met with yesterday, and he said, oh, well, he was talking about how someone had a cure and they were free of cancer. They were cured. And he was like, I hope that will happen to me. I was like, I hope that will happen to me. That you have no evidence of disease in your body. That did happen to you.
Yeah.
Like, start speaking to this and speaking it into existence.
Yeah.
Right.
Positive thoughts, positive
and then
words.
people are like, I'm worried I'm going to get burned. Like, I'm worried I'm going to get burned in the future if I do that. Gosh, so you want to spend all your time not believing in yourself now because you might regret it down the road?
Yeah.
Like, no, you have to believe in yourself now.
Yeah. Yeah. Live with no regrets, 100%. Want to finish off, Keith?
Yes. Well, actually, Amy, how about sharing some more information about what you do and your program and how people can find you as we close this out?
Yeah, so I'm most active on YouTube and Instagram. But you can also find me on Facebook and TikTok. But if you want to speak to me or DM me, that's YouTube and Instagram usually. Now, our flagship program is the Cancer Freedom Program. So that's a combination of one-on-one and group coaching. That's where I welcome in high-achieving women who happen to have been diagnosed with cancer and they want to get back to being high-achieving women. That's that community that we help them through nutrition, movement, and mindset to really just have this complete and holistic healing. So not only they're free of cancer, but they're free of the side effects as well.
Great. Yeah. So how do they find you? I mean, what you have a handle or
you can find me, the website's cancerfreedomprogram.com.
Okay.
Or you can find me Dr. Amy Morris on Instagram.
Okay. We'll put that all in the show notes and all the links and all that. So we got you covered, Keith, and we got Amy covered.
Yeah, good. Okay. Good.
This has been absolutely amazing. I mean, reality is, we're cutting short time because I did want to talk about the progression into motherhood and all. There's so many other things I wanted to talk to you about, but this kind of leads to hopefully another segue where we have you back in the near future. We could kind of continue from where we are now because I think it's so important because what you've been through and going on to motherhood is such an important journey in your story. And I think a lot of individuals that are, especially nowadays, younger and younger getting diagnosed, they could kind of relate to your story and learn from your story. So we'll have you back for sure, Keith, and I would probably love to have you back as well.
Yes, definitely. That'd be great.
Yes, absolutely. I'd love to have that. And I'll have both of you on the Cancer Freedom Podcast.
That'd be awesome.
Great.
Yeah, we're doing some recording now to plan out into the summer months because I don't like to record during the summer, because it's so short here. But so we're planning that out now. So we should do that.
100%. Great. 100%. Thank you so much. Very nice meeting you. And there's probably a lot we could talk about with Canada too, with all the politics and stuff too. Lots going on in this country right now. With you, Keith, Americans, what are you guys doing to us?
I don't know.
Oh man, I love being Canadian so much. It's so beautiful here. That's all I always just say that. It's so beautiful here. That's it.
Awesome. Thank you guys.
Okay. Thank you.
Bye. Thanks for having me. Bye-bye.
Bye-bye.